condition. One of the diseases is called the young syndrome. You will be young, so one of the important points that infertility. Only single point along with the infertility with the bronchiectasis diagnosed young syndrome. Next to the young is another Y for yellow nail syndrome. So once again, having bronchiectasis, you've got a yellow nail. Having lymphoedema, another important one. The yellow nail, yellow having L, alright, double L. So you need to remember L for lymphoedema. You must remember the S is a feature. These three are enough to reach your diagnosis. If you miss the lymphoedema, you miss the one important finding. You shouldn't miss it. Yellow nail, bronchiectasis, along with lymphoedema. So diagnosis. If the cases are having some hospitals, then they will put it definitely. They will see how you are going to. That's it. You are thinking about them so that you can, one by one, you can out them together and make your diagnosis. So these are the important cases basically put together in a bronchiectasis station 1, station 2 and station 5 by now. So now let's talk it gets behind once again. Number 1, childhood pneumonia and measles and fibrosis. How can you get in a station 1? We don't have any chances. We will not get any of the clues, but keep in our mind. It will be helpful in station 2 and station 5. You can ask the patient directly. So once again, that is the case in station 2. That is the case in station 5, not in the case here. Got it? Immediately after the infection, the TB. Might I listen very carefully? TB is your case. India, yes, case. Bangladesh and other developing countries, there's the TB case. Post-TB bronchiectasis, solid, something like that. So in that case, the TB bundle packs, once again I say it. TB bundle packs starting with the yes, the ethnicity starts with the ethnicity. The Bangladesh or Indian guy, Indian women or Bangladesh women. Covering the history and also the station 2 and station 5 and station 1. Not. Thank you for coming. Yes. So once again, what are the TB bundle packs? Mind the 5 important bundle packs that you need to remember. Number 1, ethnicity. Number 2.
Sorry, number 1. What's number 1?
Ethnicity. Indian, Bangladeshi, whatever, the origin. Second important point, the recent travel to India, Bangladesh. Recent travel. Third important point, any family members suffering from TB. Any recent travel, any family member recently, right, means any recent exposure to open TB or TB. Number 4, any personal past medical history of tuberculosis, personal history of past medical history of TB, treated or untreated, whatever. Number 5, any biologics she is on or he is on. Any biologic, especially the TNF alpha blockers. Just write it down, yes. Any biologic, especially the infliximab. I put the T for infliximab so that you can remember TB reactivation. Infliximab is more prone to develop the TB reactivations. One of the biologics is very good. The name is rituximab that is used in our country. I put the rituximab, the Bangladeshi drug, no chance of tuberculosis. So it's nothing but the anti-BD20, anti-CD20. So drugs, once again, what I'm saying, the 5 important questions that you can ask whenever you know about in station 2 and station 5. But now, what about the station 1? We have a single clue, just write it down. What is that? The BCG scar mark, my dear. Just look at that, BCG scar mark. If it is absent, so it goes with once again. Yes. Along with definitely one of the 5 important things. Yes. So once again, station 2 and station 5 will have the chances. Or you can see right with the Indian guy or Bangladeshi cripples, right, having some of the low BCG scar, having bronchiectasis, think about it now, post-TB bronchiectasis, right? Immediately after that, we talk about the infection, the tumor bundle back, is the obstruction. Obstruction, the foreign body line, is very important. It can be okay in station 2 and station 5. It is no clues, nothing is any of the history of foreign body that we can. Or maybe the patient didn't know what is the reason, why happened this. No other cause you found, maybe the foreign body is the cause. Understand? Maybe intentionally, maybe unintentionally, those the patient doesn't know. One of the bronchus is blocked. So that part, very localized bronchiectasis that you not the diffuse variety like the cystic fibrosis. Next to the foreign body is the lymph node. So once again, the lymph node will have the localized bronchiectasis, localized. Lymph node, foreign body and tumor, they will produce the localized bronchiectasis. So my dear, don't forget the lymph node caused by the TB, sarcoidosis and lymphadenopathy, means the lymph node. Don't forget the sarcoidosis, don't forget sarcoidosis. So sarcoidosis is in the Africa. Ethnicity is Africa. Yes. They will have the skin manifestation, is very much important. That includes the South erythematous lesions toward the skin. It was scarring toward the nose, it involves mass the nose and along with the whole bodies. Africans already having some of the skin lesions. Having some of the respiratory syndrome, chronic, so think about yes, sarcoidosis, the likely diagnosis. Clear. Station 2, station 5, even station 1. Clear. Immediately after that, right, the tumor, as I said, the cancer bounces back, yes, the things that already been done, so we need to examine that. So we done the infection, we done the obstruction. Immediately after that, immunodeficiency is the hypogammaglobulinemia. Once again, this is the list second to the cystic fibrosis. Hypogammaglobulinemia. Iron deficiency is very, very difficult to look after in a history and just you need to remember. Right? Immediately after that, once again, immunodeficiency, HIV. So HIV risk factors, once again, you need to actually station 2 and station 5. You need to take history. Next to the overimmunity, once again, I say the ABPA, allergic bronchiectasis aspergillosis. When I listen very carefully in station 5, they have the history. These gentlemen having bronchiectasis. Right? Now once again, this is cleared up. And he develops a sputum production and this is not controlled in some drugs. Having asthma not controlled recently, what is the diagnosis? Number 1, maybe the ABBA and second important cause, my dear, asthma associated disorder, important disease, there is a Shattuck syndrome, just remember, this is your case. Yes, it is very important. Just can you write down the asthma associated disorders are asthma-associated disorders are I say then EGPA, just write it down, the mnemonics. EGPA, asthma-associated disorders are, and mnemonics are the EGPA. EGPA. Might listen very carefully to the new names of Shattuck syndrome is EGPA. And EGPA is also a mnemonics. So just write it down. What I'm saying is asthma-associated disorders are nothing but the EGPA. EGPA is a new name. Listen. Are you listening? Are you getting it? EGPA is a new name of Shattuck syndrome. Got it? It's a new name. EGPA. What does it really mean? I'm saying eosinophilic granulomatosis is cholangitis. Got it? So EGPA itself is a mnemonics. So E for EGPA, done. Z for guard, just write it down. And P for pen and N for alpha. Once again, E for EGPA itself, EGPA / Shattuck syndrome. E for EGPA or / Shattuck syndrome. G for guard, gastricity reflux case. Gastricity reflux can be case might in station 2, I'm saying, station 2. Chronic cough, just like a bronchiectasis. Maybe the patient has a bronchiectasis, but having chest pain, hard cough. So diagnosis is guard in the case. Don't forget it. Yes, once again, P for pen, polyarteritis nodosa. Just write it down, SsAcademy channel, YouTube, pen lectures. Eat today and look at that, right? And not say anything, just look at that. Once again, A for alpha, ABP, allergic bronchiectasis aspergillosis. Another box, just write it down, bronchial asthma plus eosinophilic case might, for example. Bronchial asthma plus eosinophilic. Number 1 diagnosis, once again, EGPA / Shattuck syndrome. Number 1 means 1. You put the number 1. And second diagnosis in ABPA, once again, allergic bronchopulmonary aspergillosis. So if I'm saying now the question that what are the features of ABPA, so I say the A for allergic, just write it down quickly. A for allergic. A for allergic. It has been equal to, just write it down, bronchial asthma plus EO arrow of eosinophilia. IG arrow ups. Just write it down. So A for allergic, no doubt, right? These allergic means, just you need to remember A for asthma plus EO arrows means the eosinophilia, right? Plus IgE arrows. These allergic the words that you need to remember all together. That's it. So asthma means only the which. Single word. Means in your history, the which is the most important part of your asthma that is added in your diagnosis of asthma. B for broncho. Broncho means bronchiectasis. Now you got it. Broncho means bronchiectasis. So now what you got? Asthma with bronchiectasis, the diagnosis. Correct. Bronchiectasis means that once again, the bundle tax you know about. P for pulmonary, just write it down. Pulmonary. What does it mean? You need to remember the chest X-ray, CXR. Transient shadow, transient infiltrate, sometimes transient, sometimes there, sometimes it's changing. But for a long-term case, ABPA for apical zone fibrosis is the most important. Long-term cases for apical zones, alright? And A for aspergillosis, you need to give the evidence of aspergillus precipitated, antibody positive, especially the IgG precipitated, just you need to remember. IgG antibody. And one of the important tests that you need to remember, A for, everybody knows the AS test. I just put the RAS test, radio absorbance test, allergic test, for IgG precipitating to cleanse the aspergillus. That's it. A for aspergillus, A for AS test, I'm saying that. So what I'm saying, might listen very carefully, you have the case registration form. Asthma not controlled nowadays. What's going on? Asthma will not be the case. The cases are Shastra syndrome means the EDPA, then another line. EDPA. Right? That is only the things that you need to know. Means some of the features we discuss. We'll get a chance to discuss some of the vasculitis really important for us. So I'm just saying the first diagnosis means first. You know, some of the features you get, but this one fact is the first diagnosis first. And second is a DD is an ABBA, but ABBA having the bronchiectasis, but the Shastra syndrome never bronchiectasis. Got it? So you need to cleanse that, the diagnosis has. Alright? Enjoying it? Yes. I'd like to finish here, my dear listen very carefully, for all of the cases, whatever the respiratory cases might be. They will ask you, what the diagnostic tests for these cases? For bronchiectasis, in that way, the diagnostic test, whenever they will ask, what test they use? Simple question they will ask. Through way of speaking something like that, I'd like to confirm bronchiectasis first by doing the HFRCMCH scan of chest. Secondly, I would like to do pulmonary function test with the DLCO. Pulmonary function test with the DLCO. That will give me the obstructive lung defect. If it is a case of cystic fibrosis, initially we get the bronchiectasis, obstructive lung defect. Say this, you got a chance, alright? Say this one. If it is along with the fibrosis, then in that case, maybe we have the chances to get a mixed variety of OLT and RLT. Understand? In cystic fibrosis. In bronchiectasis, any other cases, you'll never find something like that. Clear? So this is the bronchiectasis diagnostic test. Number 2, that you will say, I would like to confirm my etiology as I suspect is cystic fibrosis. The way that you need to speak, I'd like to confirm my cystic fibrosis by doing a genetic test. Before of the generic test, I would like to do the sweat chloride test. C for cystic fibrosis, C for chloride test, C for 60 or 70 or 40, chloride or sodium level greater than. Some books write 40, 50, 60, 70. We will say everything. The accepted is more than 60. So that's why I'm saying cystic fibrosis more than 60. Sweat chloride test or sodium level greater than 60 is a suspicious test, not a diagnostic test. The diagnostic test is a generic test. CFTR, Del 508, just remember. CFTR, gene, on chromosome number 7, autosomal recessive disorder. C for 7, C for CFTR. Del 508, the most common mutation. Del 508. Del 508. So what is the next question? They will definitely ask what is the management plan by you. Listen very carefully. One of the respiratory plays the management plan in last. We'll start something like that. I'd like to manage my patients under the headings of 3 headings. Always say this. I'd like to give good him or her on some general measures. Secondly, very specific medical management, medicine treatment, and third, specific medicine treatment. And third, once again, the surgery treatment. So these 3 headings. Immediately after they will say, right, general measures include. Number 1, smoking cessation for all cases. Whatever you respiratory case, chronic lung disease patient. Smoking cessation, number 1. So you stop the oxygen, you should give the oxygen. People say the smoking is oxygen. I don't know how to oxygen. It's a carbon monoxide, it's an oxygen, right? So yes, so stop smoking with the smoking cessation. Second point is the oxygen. Question mark whether this patient fits the criteria, the L top. Just write it down. Immediately after you say that in chronic lung disease, whether this patient fits the criteria, then I'll put him on L top. Number 2. Number 3, my dear, if the person is having any signs, any features of bronchospasm, we put on him, or we put him on bronchodilators. Just write it down. Number 3. Whatever the lung disease, doesn't matter. Any bronchospasm, just put him on yes, bronchodilators. And number 4, any evidences of infections, we will put him on antibiotics. Evidences of infections, my dear. Number 1, sputum color. Number 2, fever. Just write it down, very important. Sputum color change, fever, pleuritic chest pain, features of consolidation. That's it. Very specific, very specific. At the bedside. These are the general measures. Number 5, general measures. For all chronic lung disease, we put the patient on vaccination, pneumococcal and influenza vaccination. So number 5 is vaccination. Working a long time, so I think we got a chance. Start with this, right? I start the general measures with the medicine management, with the surgical treatment. Then general medicine include this. Immediately after they will say, I tell you the medicine. They will say, or they will listen. So the medicine management in bronchiectasis is very much for specific therapy of treatment. What happened in bronchiectasis? Bronchiectasis. You don't treat the patient, you don't cure the patient. So what you need to do the expectorations. So number 1 point is an expectoration. Help the patient with expectoration. It includes once again physiotherapy, chest physiotherapy, the first 9 treatment. There are long list of therapies are given. Active cycle breather, any chest physiotherapy, mass, chest physiotherapy. Second important point, the long-term antibiotics. Long-term antibiotics here. The word is long-term. This is 2 important words. These 2 important words is important here. And how we help the expectoration? Expectoration will help the physiotherapy, number 1. Number 2, mucolytics. Just write down mucolytics. Mucolytic syrup, N-acetylcysteine. And next to the surgical treatment. Surgery is a lung transplantation is definitely treatment. Lung transplantation is definitely treatment for bronchiectasis and cystic fibrosis.